You're watching Speak Out India with me, Vedika Sachdeva, and the question we are asking you today is to do with the 7 billionth mark that the world has reached. While this show over the birth of the 7 billionth baby, we bring you the story of two Indias. Infant Nargis will be remembered as the symbolic 7 billionth baby to be born in Uttar Pradesh, but in another state. In West Bengal, the cry and helplessness of parents is resounding as the death toll of infants in the state rises to 41 in just 6 days. Pressing us to ask if Nargis's life will hold value or will she also face the fate of several others in India. And that brings us to the question we are asking you tonight. Is the birth of the 7 billionth child in India a reason to celebrate? You can call us on the numbers flashing on your screens and we will take your calls live. Amidst cheer came the news of the world's 7 billionth baby being born in India. This is Nargis, the world's symbolic 7 billionth baby.
इतना अच्छा महसूस हो रहा है कि कभी हमको इतना अच्छा महसूस भय नहीं है जितना मतलब महसूस हमको हो रहा है.
If Uttar Pradesh is the most populous state in the country, then the state has another feather in its cap today. The world's 7 billionth baby will take birth in Uttar Pradesh, Mal block in Lucknow district. And the entire world will be celebrating the birth of the 7 billionth child in this world. The 7 billionth child is supposed to be a girl child, and celebrities from across the world will take care of this child, its medical needs, its health needs and its education.
The father, who is a farmer, was felicitated with an assurance that Nargis's future will be secure.
I wanted to be associated as a sponsor because maybe I can come across and give this message across to the community here and to the family that if you give her the opportunity, she will prove to be a Shakti.
But Nargis isn't the only one. Celebrations were seen in another country as well. After the birth of this infant, 2 minutes before midnight in Philippines.
Should this landmark be an alarm bell for India? Especially after Bengal as well as Uttar Pradesh have seen a spate of infant deaths. Now here's why we should be worried.
According to latest data available, there are 47.57 deaths per thousand in India. 1 million girls are killed before or after birth per year. 2,000 unborn girls are illegally aborted every day in the nation. Nearly 2 million children die before the age of 5. And if that's not enough, neonatal deaths stand at 60% within 48 hours of birth. And hope is even dim for medical assistance, with the doctor population ratio standing at 1:1700.
A lot of people, for wanting a male child, they keep on having more children, and then they feel one son is not enough, they must have 2 sons, 3 sons. So if there is there's a strong social security mechanism, and people know that they would be taken care of in their old age by the government, by the social security mechanism, then they would not do this.
But as India witnessed history today, the big question is India ready and equipped to handle the burgeoning numbers? Bureau Report, NewsX. And we also have a guest on the show tonight who joins us live from Mumbai. Shaina NC joins us. She's a national executive member of the BJP. Shaina, thanks for joining us live. We will be coming to you in a bit. But before that, I have 2 callers on the line. Sangeeta calling in. Yes, Sangeeta, go ahead.
Yes, I would like to express my opinion regarding this. I mean, I have a feeling that the population of our country is too high compared to the resources of our country. So this is high time that the government takes measures to control this population, to produce quality. So until and unless there is quality produced in the population of this country, I feel this is really alarming.
Right. Right, Sangeeta, thank you so much for calling in. We have another caller on the line. This time it's Sukumar calling in from Chennai. Yes, sir, go ahead.
Vedika, the answer is a very big no. There is no reason for us to celebrate, particularly third world countries and particularly India. Hello?
Yes, go ahead. So you need to keep your television volume on mute.
The problem is, whether it's the present UPA or the previous NDA or the governments before, the entire governments are all seem to be focused on developing cities and infrastructure and things like that. But I would say this automobile population or the mobile phone population are just pockets of affluence in a huge oasis of underdevelopment and poverty.
Thank you so much for calling in, sir. Thank you so much for calling in. Let me go across to Shaina now. Shaina, what do you make of the situation? Do you think the birth of the 7 billionth child in India is something to really celebrate?
Well, I think the fact that this 7 billion child is born in a household in Uttar Pradesh, and that too is a girl child, is something that we should be proud of. On the other hand, if we take a comparative study of what is happening in West Bengal, it's absolutely appalling to know that, infant mortality has reached a number of 41, and you have a chief minister there who's not even commenting. And I'd just like to quote what the union minister has said here, that such child deaths in large numbers is quite normal. I do not know why there is so much uproar being created over child deaths in the state, is what Sudeep Bandyopadhyay has said. So I think it's a bit of an irony where you have on one hand, infant mortality rate, where as a country we're constantly comparing ourselves to Brazil and China when it comes to economic growth, and when it comes to infant mortality, you have every 50 deaths in 1,000
Right,
births.
Shaina, I'm going to come back to you, especially on what Mr. Bandyopadhyay had to say. A shocking comment coming in from him, but also joining us tonight is Ms. Ranjana Kumari. She's the Director, Center for Social Research. Thank you, ma'am, for joining us. I'm going to come to both of you in a bit, but before that, let's take a few more calls. I have Prabhakar calling in from Bangalore. Yes, Prabhakar, go ahead.
We are hearing the same news, same thing is repeating. Now it is in Calcutta. Tomorrow it can be anywhere in other cities. Even the gate city like Calcutta is not able to control these type of things. What is going to happen to our country?
Right, Prabhakar, I have another call on the line. This time it's Rakesh calling from Kolkata. Yes, Rakesh, go ahead.
See, the world population has become 7 billion, and out of that, over 25% is contributed by India itself. Because in '99, our population was below a billion, a little below a billion. Now we are 1.23 billion. So you see, the resources are scarce, but the population is going up like crazy. And especially in the rural side, where people don't even have enough economic, they are not, rich enough.
Right, Rakesh, thank you so much for calling. Coming back to you, Ms. Kumari, my question to you is, it's really a story, ironically, of two Indias here. On one hand, we have people celebrating the 7 millionth baby being born in India. But on the other hand, it's the same state that is suffering from encephalitis, where children are dying. And on the other hand, you have West Bengal, where infants are dying all over again.
Yeah, absolutely true. Actually, first of all, it is reason for celebration, because I heard this and read this amazing fact that, we can make almost, if we hold hands, 15 rounds of the earth, and 7 times we can go up to the moon and come back. Things like that. So we have so many people. But at the same time, it's so sad that, we do not value human life. We do not value child's life. Which after so much of the light, some response was there, and now in Calcutta, look at the way children are dying, and every day reports are coming, and the chief minister, who is a woman who is supposed to be having some motherly instinct in her in terms of being just nurturer, carer, the women, she says, don't ask me these questions. Now what kind of a response is that? If government cannot handle it, there is a large private sector which is making money out of people's misery in a big way, in all the hospitals are, multiplying in terms of nursing homes and hospitals in the country.
Right, Ms. Kumari, I'm sorry, I'll have to interrupt you there. I have 2 more callers waiting on the line, and we're going to discuss this even further. I have Ranveer Singh calling in from Haryana. Yes, Mr. Singh, what do you have to say?
Ma'am, this is Ranveer Singh Dalal from Rohtak, Haryana. I would like to say that I fully agree with Mr. Union Minister's statement that there's nothing to celebrate. But who is responsible? Out of 65 years of rule independent of India, 56 years have been Congress in rule, and they are not bothered about controlling the population of this country. Then who is to blame? Mr. Azad, wake up and better stop this reservation policies for the underprivileged, and better control the population of this country so that our country can progress. Thank you very much, ma'am.
Mr. Singh, thank you so much for calling in. Prashant also calling in from Mumbai. Yes, Prashant, go ahead.
Hello, your question is that 7 million children is a question of celebration.
Yes, sir, go ahead.
Then I'd like to ask the Indian minister that what is the question of celebration by killing the child of 7 million?
Right, thank you so much for calling in, Mr. Prashant. Coming back to you, Shaina, out here there's an irony of sorts really. On one hand, there are children being born, we're celebrating their birth. But on the other hand, we're letting the same infants die in another state.
Absolutely, I think it's very ironical, and the sad part is you have a woman chief minister who has chosen to stay completely silent. She has not passed a comment. You have Mr. Bandyopadhyay there who's saying this is absolutely normal, and then on the other hand, when we hear of the way people, the children in various parts of India die, be it tetanus injections, lack of folic acid, childbirth, diarrhea, this child we're celebrating about, the 7th million. In that family itself, they've lost one child just with diarrhea. So I think we need to really get our act together. Our systems have to be in place, and I'm glad it was your caller saying it and not me, that in 56 years of Congress rule, if we can't ensure basic amenities such as good health to every child that is born, what is the point of talking about population?
Shaina, we also put this question to people in Kolkata, asking them about what the minister, Mr. Bandyopadhyay, had to say, and also their reaction to these infant deaths. Let's listen into what Kolkata had to say.
Population should be controlled. Then the babies will not die because they will get proper treatment, everything. As because there is much population, so it's a problem to get treatment properly.
We are quite aware of it, that the hazards of population explosion, it leads to a number of problems in the society, in economic growth. We have to think in the point of view of globalization and other aspects.
And we have a call from the capital, Devendra calling in. Yes, Devendra, what do you have to say?
I am Devendra Sahai, Secretary General of Global Warming Reduction Center of India.
Yes.
What I want to say is that population should not be looked at in isolation. It should be looked along with the country's or the Earth's resources, as well as the Earth's or the country's ecosystem. The country's resources are finite, and so are the Earth's ecosystem. If the population goes beyond the carrying capacity of the Earth's resources or the Earth's ecosystem, then you start seeing overall damage and deterioration of resources and ecosystem, and that is what is happening. And you see 1,000 bad.
Right, Devendra, thank you so much for calling in. Another call coming in from Srinagar this time. It's Shafi calling in. Yes, Shafi, go ahead.
Madam.
Yes, sir.
Good evening, madam.
Go ahead.
Madam, this is an event where we should celebrate the 17th billion child. But on the other hand, we must enhance the health care of the children. You are seeing that children are dying because of encephalitis, and they are dying because of poor malnutrition. We have to take care of. If we don't take care of these things, the babies are dying day to day, then what is the fun of celebrating?
All right, Shafi, we get your point there. All right, before we go ahead, let's also tell you what's happening in Bengal. The horror in Bengal continues. There have been 41 infant deaths in 6 days, and we're still counting. While the families demand answers, the administration of the Bardwan Medical Hospital refused to accept any blame or accountability over these innocent lives being lost.
The situation in Bengal only worsening. 5 more infant deaths in the Bardwan Medical Hospital, taking the toll to 41 in the state.
মোটামুটি আমি যে আইডিয়া করলাম আর কি ট্রিটমেন্টটা যেভাবে হওয়ার দরকার ছিল সেভাবে হয়নি।
The pressure building on the chief minister to act, but Mamta still choosing to stay silent. Her men deflecting blame.
Of course, it's a cause of concern, and we need to look at it. I think health and education were the 2 major issues that the chief minister had taken up. So I think on education something is moving. I think health also. But meanwhile, this unfortunate tragedies are taking place.
Health is totally a state subject. I cannot utter any comments suo moto that how the district hospitals are going to operate or to function.
The shocking conditions in and around Bengal's premier hospital also being questioned.
I found people with garbage accumulated within the rooms where the babies are kept. I found dogs walking around, and I fail to understand how the Minister of State for Health has given this premises a clean chit.
What's shocking is that the people at the helm of affairs seem to see no harm in the crib deaths. This shocking statement made by the Minister of State for Health, Sudeep Bandopadhyay. And every parent now fearing how safe is their child in the hands of such institutes. With Indrajit Kundu in Kolkata, Bureau Report, NewsX.
Clearly no lessons learned there. We have two more callers on the line. I have Prem calling in from Kochi. Yes, Prem, go ahead.
Yeah, see, actually it's a reason for celebration. Because look at the family, look at the happiness around it. I am very shocked to hear the way the Health Minister of India says that it's not reason to celebrate. And another caller from North, I find that the girl child was never given importance. Really shocking that way.
Right, Prem, thank you so much for calling in. Thank you so much for calling in. We have another call on the line. Piyush calling in from Delhi. Yes, Piyush, go ahead.
I have one question.
Yes.
Ma'am. You see, we are now discussing the deaths in West Bengal and UP. What has been happening in this country for the last 62 years? And I want to say, in respect of population control, in respect of death of children, malnutrition, mother's death at the time of delivery. So it is very shameful all around, and especially in West Bengal. Ms. Mamata Banerjee, she makes only tall promises.
Right. All right, Piyush, thank you so much for calling in. I'm going to forward your question to Ranjana as well as Shaina. Coming to you first, Ranjana. It's quite strange that Mamata Banerjee had come out. She made this assurance that she's going to add a special unit to the hospital in Kolkata. But what's strange is I have statistics here to tell us that there are 75 doctors at BC Roy Hospital for 400 patients, for 400 beds and for at least 500 OPD patients.
Well, all the medical system and institutions in the country are understaffed. They are very, very badly managed. It's very obvious from what is happening in Calcutta, and I think the story really repeats if you go to any other state in the country. This is the same situation, especially when you go to the rural areas. But I think today when the child is born, I certainly agree that every life matters. Every life has a value, and especially girl children's life, because in this country, we have absolutely no respect for girl children. There is so much of female feticide going on. So there is reason for celebration. And not being able to take care of a human life is failure of the state. It is the state which has to provide for healthcare services. It has to provide for all kinds of support systems and also medical systems in the country. You cannot say that since we do not have all that, so what do? You kill people, you kill the children who are born? No, you have to. On the one side, I agree with all the ecosystem arguments and environment and whatnot. It's fine that we should have small population.
Right,
but when there is a population, it has to be taken care of, and girl children...
Right, Ranjana, let me just interrupt there, because we also need to listen into the outrage that is coming in from Bangalore over this issue.
No, we are not happy with that. So that we have to follow the family planning. And most of them nowadays, the younger people are well aware of that one, and they are following the same. And even the Muslims also, they are not giving birth more than 2 or 3 children.
7 billion होएगा तो और भी आएगा मैडम, बहुत आएगा अभी. इससे तो कम नहीं हो सकता. सब चीज़ का दाम बढ़ेगा, जैसे जैसे बढ़ेगा वैसा वैसा पॉपुलेशन भी बढ़ता रहेगा. कुछ भी कम तो नहीं होगा.
No, not at all. It should be a wake-up call for everybody, especially Indians. We are bursting at the seams. We should take care more, and we should be more serious on family planning.
Well, she has remained silent over the infant deaths in her state, and today she delivered on a promise that she had made under pressure with the inauguration of a special unit for the BC Roy Hospital. But when NewsX probed the status of the infrastructure of the hospital, what we found clearly indicates that the assurance by Mamata was made in haste.
She's been silent over the infant deaths in Bengal, but in damage control mode, Mamata Banerjee ensured the inauguration of a new unit for the controversial BC Roy Institute.
The machines, ultrasounds we are also going to procure one big ultrasound so that we can get this echocardiography facilities also, and we are in a mind to develop super specialty units.
Now shockingly, doctors and nurses are yet to be assigned to this SNCU. Required doctors and nurses are yet to even be appointed by the health department for the facility. Now they are saying 75 doctors will be treating more than 400 patients, and add to that the 500 OPD patients.
Tall promises made by Mamta's man now falling flat.
Even if I quit, things are not going to improve. That we have taken up this job and will do it. This is a collective responsibility, all of us are committed to do it. Regarding putting up extra manpower, that is already order is there for putting up more doctors, more nursing staff.
Mamata Banerjee had made tall promises regarding better medical facilities. She had said a one-year program to overhaul the healthcare system would be taken up, and none of these promises have been delivered. But just look at what she had promised. 4 new super speciality hospitals will be set up. 1 neuro speciality hospital would be set up. Short, mid and long-term programs spanning over 5 years. District hospitals would be set up to help people get treatment locally. Facilities at primary health centers would also be augmented, and several modern diagnostic centers would be set up in the state. None of this has happened so far.
But Mamta still chooses to remain mum, and her men evasive.
Government of West Bengal is totally concerned with this development of the district level hospitals, in which healthcare units are to be more strengthened. In the next budgetary support, more budgetary allocations will be allotted.
The escalating number of infant deaths is fast becoming a test for Mamta and her government. But for now, the loss for these parents has only been met with indifference. With Indrajit Kundu in Kolkata, Bureau Report, NewsX.
And indifference it is. All right, we have 2 more callers on the line. I have Suman calling in from Kolkata. Yes, Suman, go ahead.
Yeah, my name is Suman Banerjee. I'm calling from Calcutta.
Yes.
My point is I'm a little surprised that Mamata Banerjee has come to power on last May. We have voted her to power last May. And after 34 years of the left misrule, they have completely destroyed the education and the healthcare system in West Bengal. Absolutely in shambles. There is nothing left in the hospitals. Only.
All right, valid point there, Suman. I'm so sorry, I have to wrap up very soon. I want to take my next caller, Akshat, calling in from Darjeeling. Yes, Akshat, go ahead.
Yes, ma'am. I'm calling from Darjeeling.
Yes.
I just wanted to say that this is a very bad situation going on in Bengal. Like with the MOS of health should resign, and Mamata Banerjee should step down. They have destroyed the education, the healthcare system of all the Indians.
Right, thank you so much for calling in, Akshat. All right, coming back to you, Shaina, my last question goes out to you. What do you really make of the West Bengal Chief Minister's silence here? She's been not speaking, her men are coming out, being extremely evasive, passing the buck on. What do you make of this?
First and foremost, I'd like to say that she has to be very serious about healthcare infrastructure. I was reading one of the media reports which said that in this controversial Burdwan hospital, you know, they're only equipped to deal with 60 patients in the pediatric ward, when on a daily basis they have 150 patients. Now, when budgets are allocated by the state government, surely you have to ensure that you're able to treat every single patient that comes in. If you're going to have such high rates of infant mortality in a state that is promising to do the most for health and education, I think we need to show political will, rather than just paying lip service.
Absolutely, political will is the word. You hit the nail on the head out there, Shaina. Thank you so much. I'm running out of time here, but both Ranjana and Shaina, thank you so much for joining us tonight. We'll be back tomorrow with another question. Till then, goodbye and have a good night.